They're providing help, hope, and recovery to those people here in the community who may be facing mental health issues or substance disorders. We're here at Rosecrance sponsoring our segment today. We have Executive Director Melissa Pappas. Thank you for having us.
Thank you for coming.
Let's talk a little bit about Rosecrance, because you've been going here for a long time in the community.
Yes.
But what is it specifically that you do?
So Rosecrance has 4 locations in the Central Illinois region. We cover Danville, 2 in Champaign, and 1 in Kankakee, and we offer a comprehensive continuum of care from anywhere between assessment through to residential services, outpatient. We offer housing, case management services for individuals that are struggling with mental health and substance use disorders.
So if people are struggling and they're having an issue, they can have inpatient treatment, they can have outpatient treatment, telehealth treatment.
Yes.
How does all of that work?
So Rosecrance offers the ability to walk in at any time, Monday through Friday, to get a comprehensive assessment by one of our behavioral health assessors, where we will look at the entire person. We're really a strength-based organization, so we really want to know what the individual comes with strength-wise and how we can use those strengths to help them deal with their substance use or mental health issues. So they can come in, get a comprehensive assessment, and then they are matched with the right program that will be able to meet their needs.
Let's talk fentanyl, because that seems to be a growing concern here in the country. But Illinois isn't left out of that. So what exactly are the numbers, and do we need to know about that?
So fentanyl is a synthetic opioid. It's really used for pain management and some anesthetic. The issue with fentanyl, though, is that it is incredibly potent. It's 50 times more potent than morphine, 100 times more potent than heroin. And so really the concern is when individuals are using fentanyl, the overdose rate increases dramatically. And fentanyl is often mixed with other substances, heroin, cocaine, methamphetamine. And when you mix a synthetic opioid with those substances, your overdose rate increases even higher. And so in the region, there are some concerns of the growing fentanyl use. The overdose rate in Vermilion County is 30.1 individuals. The capita per Illinois for 100,000 individuals is 26. So we're seeing an even higher rate in more rural counties right now. And so there's definitely some significant use happening and some education that needs to happen in the community about the dangers of this substance.
I don't know if it's alarming or not, but it is to me. Rural communities, why do you think that is?
I think rural communities experience an increased amount of barriers to getting into treatment, as do more metropolitan areas. Usually substance and mental health facilities are at a lower rate in rural communities. Transportation can be an issue, childcare, being able to get into the facility when the facilities are open. Usually individuals in rural communities, their work hours don't match with the facility hours. And so I think that there's just an increase in barriers when we're looking at those areas. And so treatment availability is lower.
Okay, what other issues do you address here besides the fentanyl use? Because you offer a lot of services.
So when we're really looking at the whole continuum of care, we are looking at both substance use services and mental health services throughout the lifespan. So we treat children all the way into adulthood, and we really focus a lot on those co-occurring disorders. What research has found is individuals with substance use issues often have mental health issues, and vice versa. And so when an individual comes in for an assessment, like I said before, we're really treating the whole person and really making sure that their care is individualized.
Okay, we're also having an issue, I'm guessing, with alcohol use as well.
Yes.
So is that right up there with the fentanyl, with what you're seeing?
Alcohol, yes. Alcohol is actually our #1 substance that individuals come in with. So it is still being seen at a growing rate. It has not decreased at all throughout the years. And that is typically the substance that we see in our residential treatment programs.
If someone out there, or they're having an issue, a mental health crisis, or a substance abuse crisis, or a loved one knows someone, what does that process look like getting in here and getting treatment started? Because there is, I would think, some kind of stigma with like not wanting to admit we have a problem, maybe. So how do you overcome that and encourage people that you're here, we're here to help you, and everything's gonna be okay?
Well, we really want people to know that there is no wrong front door. You can walk into any of our locations, you could call any of our numbers, and we will get you to the right place, to the right people, to get you or your loved one any help that we possibly can.
And I'm sure everybody's case is different, and so how long you need treatment is probably going to differ, but that's where you come in, and it's all confidential, so they can feel safe in coming here and knowing that they're going to get the best treatment. 4 locations. People can learn more online?
Yes, at rosecrance.org.
Okay, very good. Thank you so much. We appreciate the work you're doing. It's sad that we have to have facilities like this, but we're thankful that we have this resource. We appreciate you sponsoring our segment today. If you want to learn more about Rosecrance, we will definitely have all of that posted for you after today's show at CILiving.tv.